Welcome to Alzheimer's Sunrise, lighting the way for patients and caregivers on Legends 100.3. Brought to you by Alzheimer's Community Care, providing help and hope for thousands of families for the past 20 years. Here's Mary Barnes, CEO of Alzheimer's Community Care.
Hello, the Alzheimer's Sunrise here, and we're shining a light on patients and caregivers and lighting the way. And we're here, just the two of us here, Karen Gilbert, I'm Mary Barnes, and we're going to frame really what our shows are going to be all about over a period of the next couple of months. And because of the wealth of knowledge that you have, the wealth of experience that we've had at Alzheimer's Community Care, this is a perfect time for us to be able to talk about it and to actually kind of make sense out of the whole approach of what we as an organization has been so visionary about it. We've always realized that the community is the most important thing. The community and our families and how we're going to be living throughout the disease process together. And so how is that really going to be accomplished? What is some of our biggest obstacles that we're dealing with?
You've hit on my absolute passion in this topic. And that is starting with a foundation of understanding what dementia is, because that word is thrown around quite a bit.
Yes, it is.
And how that relates to Alzheimer's or one of the related disorders. And so this foundation really does lead to what we will bring to this program in the future, with experts talking about specific aspects of what we are discussing today.
Just to go deeper into what you're talking about, we so often hear, and it's so pervasive at all levels, even in the medical community, but in our everyday speaking, Alzheimer's disease and the related dementias. What does that mean, the related dementias?
We don't really know, because dementia by itself just refers to a set of symptoms. It doesn't really focus on a
root
specific
cause
disease or root cause, and we're all about getting to root cause. So initially, it's important for us to recognize what healthy aging is, as opposed to when we might begin to see the beginning symptoms of a true neurocognitive disorder. And the main concepts with healthy aging are that we may be a little forgetful from time to time, but what we need to remember does come back. What's critically important is that our basic personality does not significantly change. Our behaviors, our habits will not significantly change. We recognize what is safe and unsafe, what's reasonable or unreasonable, what's appropriate or inappropriate, and what might be a scam versus a legitimate enterprise. That's all healthy aging. So when we see a failure in one or more of those, that memory is forgotten and it does not come back. This person falls victim to a scam. The typical one, this is the Internal Revenue Service calling you, you owe us $10,000, you haven't paid, we're getting ready to sue you. Frankly, I've gotten that call 3 times. I know it's not legitimate.
But that's tricky, Karen, because of the fact that this disease comes on, especially when the diagnosis is so, in fact, Alzheimer's, it comes on very slowly. And, we as children, we as other people are part of the family, and looking at this, we're very hesitant, and we make denial. We're making excuses. We'll say, "Oh, she's having a bad day," or it's really a complicated issue, and and there's always that skill set that person who is the potential patient, because at this point in time it's all probable that they're saying, I'm fine, things are a little bit, I was upset this morning, I didn't really get a good night's sleep. You make all kinds of excuses,
and dismissing those is the problem.
And do you think that person who's saying that, do you think that they're actually aware of something going on? I happen to believe, Karen, they are. I happen to believe that because of who they are.
Oftentimes they are, and they can compensate for it.
They don't know it's the word Alzheimer's. They don't know it's a word of that degree, or the more common word that they're going into some form of dementia. Can you actually define what the word dementia, how does the doctors use that?
The doctors use it in well over 50% of the families we work with as a diagnosis in and of itself.
But what leads into it? I'm going into a
the
point.
family's complaint or the patient's complaint of memory failure.
But they're also saying that there's 2 adult daily living activities that they can no longer do, 2 or more. And that's when the trigger comes
That's
in.
when it should be applied, but that's not always the case.
Well, they come up with the word dementia, but that doesn't give the root cause. That doesn't say what is the. It's like you've often said, we talked about, you have a fever. Do you walk out of the doctor's office, I got a fever? Don't you
No,
ask?
you need to know why.
Why?
And how will you treat it?
And we do that so often, but then this other thing, you want to know exactly what the prognosis is. What is it going to be?
You've hit on something very important. One of the reasons that most people in this country that ultimately will be competently diagnosed with Alzheimer's are not addressed until they have already reached middle stage.
Yeah.
And that is for many of the dynamics you just mentioned. That early stage patient can compensate because they know something's going on, and it is very frightening. And the family may be in denial. It is very hard to admit that your loved one may be developing an incurable disease. So we understand that. The irony is that's when we need to act. We are 111 years into knowing what the pathology of Alzheimer's is. Tau and amyloid protein pathology. But we don't have a cure, and we don't have a disease-modifying treatment.
That's right.
And so what that tells us is we must have people more alert to that earliest sign, just as we've all accepted we want to recognize the earliest sign of a tumor, of a breast tumor, of cervical cancer, because we can then address it much more competently.
And that is what's so sad about this whole disease process. If we could see a mass, if we could see a tumor, if we can see a rash, or we automatically go for medical treatment.
That's right.
But when it comes to this other, about going for a cognition type of testing or other parts of, are trying to look at the different identities of what's going on in so many different ways. Because again, if you have Lewy body's disease, how the early signs are different from what you'll be with Alzheimer's, or if you're talking about vascular dementia, it's
That's right.
also there's a pathology and different than what you would with Alzheimer's.
Here's one other very important reason to address potential symptoms as early as possible. They may actually be treatable. Making a leap that this person may have an incurable, irreversible neurocognitive disorder may really be a leap. There are many treatable conditions that will cause symptoms of dementia. Clinical depression. Someone who is clinically depressed will have symptoms mimicking someone with dementia. However, clinical depression can be treated. They may have a low-grade infection. They may be dehydrated or malnourished. That can be corrected. They may have an underactive thyroid, very common as we get older, and relatively easily treated. Vitamin deficiencies, B12 in particular, not a typical part of an annual exam. So how do we know? We need to ask for that test.
You know that whole series of what you just came out with, Karen Gilbert, who is with Alzheimer's Community Care, and she's our vice president of education. I have to tell you, Karen, I've been doing this since 1985, and you're one of the most, how shall I say, not only caring, but knowledgeable nurses that I've ever had the opportunity. And now you're going to another expansion of your life and going and getting a degree almost equivalent to like a PhD, but in nursing. And you are using Alzheimer's as your prototype in helping this type of designated award in academia. That's breaking barriers. That is breaking barriers because you're making it part of an academic picture.
This
for
education.
our healthcare and using this whole concept, and it's going to lean towards medical principles, which
and
is
policy,
and
yes.
policy
Yes.
development, and that's what you're really after, and
Yes.
that's what you're really, and we are as well, because we can't be the only organization in the country that is defined itself of what a dementia-specific, community-based service provider should be all about.
That's right.
And that's what really this radio, what we're doing here every Sunday is going to be all about, and we're going to be exploring this, and we're going to be putting nails into hammering away into our whole story here at Legends 100.3 FM on Saturday mornings. This is exciting for us. Sunday mornings. This is exciting for us. And having this kind of enlightening And again, it's important. We labored over the words Alzheimer's Sunrise for the name of this program. It was quite an interesting dynamics within the studio here. And we all agreed, Alzheimer's Sunrise, because of the authenticity that we try to bring to the subject matter, and we vet it so much.
We need to arm our caregivers and our patients that there is something they can do when they do it early. Additional treatable conditions, poorly controlled blood sugar, also very common with older type 2 diabetics. It can be treated. Brain tumors can be treated, whether they are malignant or benign. Menopause. Menopause
that's
is
the latest finding.
That is the latest finding. Women who have been labeled, quite frankly, with dementia or even Alzheimer's in their 50s, only to push further and find that what they were suffering were symptoms of menopause. When treated, those cognitive deficits actually resolve. So that's huge. Exposure to toxins. This is why social history is so important to us. Someone may have a desk job during the week, but they may work with highly potent chemicals on the weekend. Pesticides, refinishing furniture. These are things that can affect cognition. They are reversible. And of course, medications. And I think in future programs, that is a topic for itself.
Pharmacology,
polypharmacy, which is 4 or more prescriptions, which most of America takes. Certainly the adult population causes very significant problems and can actually impact cognition. And if some of those medications can be reduced in dosage or even eliminated, we get a lot of clarity in our patients. How many times a caregiver has said, Mom really cleared up when they discontinued her medications half of her medications.
We get calls all the time, and all the time we have to refer to, have you talked to the doctor? And so often that connection is not made. So it's a very, very ongoing, challenges for us in connecting the two. The
important thing, I think, is recognize when you, yourself, or your loved one is not their usual self. Something is going on.
Right. We're going to take a little break right now. This is Alzheimer's Sunrise and leading the light for our caregivers and patients. And
you can reach us readily at 561-683-2700. You can also send us comments or questions by email, info@alzcare.org. That's ALZCARE.org.
We will be right back.
For Alzheimer's patients and their caregivers, daily life presents many challenges. Be a giver of hope this season by attending Alzheimer's Community Care's annual Palm Beach Luncheon, February 7th at the Beach Club in Palm Beach. All proceeds from the lunch and silent auction benefit patients and caregivers in Palm Beach County. Visit ALZCARE.org for information and to purchase tickets.
Well, welcome back to Alzheimer's Sunrise and shining a light on the pathway for our patients and caregivers. Karen, we were just very involved in a conversation about dementia and about Alzheimer's and about other types of ways that it could be people think, and even in the medical community, that it's tied in with age.
That's right. And this is where there may be that leap to, this patient is 75, they're complaining of memory, problems, they don't want to pay the bills anymore, they can't really get that done. This is dementia, or this is Alzheimer's. We need to break through that barrier. Age should not be in the decision making. Yes, age is the greatest risk factor for ultimately developing Alzheimer's disease, but we still have this whole list of treatable conditions that could strike someone in their 80s, could be treated, they could resolve. Clinical depression, hypothyroidism, that's underactive thyroid, a low-grade infection, dehydration, vitamin deficiencies, a brain tumor, which can be treated. So we do not want age influencing that decision. Their symptoms need to be completely vetted as if it was a heart issue or a lung issue. We don't base that evaluation on age. We do the complete workup.
There's a misconception that they cannot really diagnose Alzheimer's without an autopsy, and that is no longer the truth.
That's no longer
That's no
true.
longer. It used to be, and then when I started working in 1985, there was that feeling that it was all exclusion. Now it's being diagnosed by inclusion of all the tests, and there are about 97, 98% on.
They can get high 90s. If you talk to the researchers that we often work with and we consult with, they can't be 100% because they're not actually looking at a biopsy of the brain. Of course, that's very invasive. We wouldn't do that routinely. But they can look at a little volume of cerebrospinal fluid.
That's right.
And they can look at the balance of proteins in that fluid. They can do imaging, the MRI, the PET scan, the CAT scan, and they can put the information together with, very critically important, the history conveyed by the patient, if he or she can, and of course those closest to that patient. That history, how has this patient deviated from their usual? That often gives you a great insight into what is actually going on. Is it something slowly progressive, like a neurocognitive disorder like Alzheimer's, or is it one of these treatables? It needs to be a very thorough workup.
And that can be more of a challenge because, especially down here in Florida, we're from all different other parts of the country. They could come down alone, or there's no family. And so when these signs start happening and having to go in and counsel with the doctor, many, many times, especially in the earlier stages, is depression. And there's no two ways about it. In the early stages of a neurocognitive disorder, there is depression. Matter of fact, there's depression with the caregiver as well. So we're looking at both here, and that's where the challenge is. But you're right about the history, and there's other kinds of ways that people are taking their medical history with them. There's thumb drives, and there's all kinds of encouraging to take that with you. So when you do come down here, or when you go back home, really, Karen, we advocate that whatever you're doing down here should mirror what you do back home, or you're going back for 6 months and then coming back down here for 6 months. And it's the same thing, them up there mirroring something that's coming, that they've discovered of a different type of care treatment or something should come down here.
Absolutely. And by now we were supposed to have an integrated health information exchange, meaning electronic medical records that could actually talk to each other no matter where you were in the country. It hasn't happened yet. There are privacy issues, of course, but we're also talking about safety issues, medical safety issues. So we really do need to get there. A huge aspect of what might be going on with a patient, we mentioned a little bit earlier, medications. We beg every patient, or if it's someone with a caregiver, do not bring a list when you go to that medical appointment. Bring the bottles. And a lot of medical practices are getting on board with this. They actually have it on their website. If you're a new patient, bring all of your bottles.
Is that including the vitamins people are taking?
Everything. And here's why. Supplements that you can buy over the counter, nobody knows you're taking it, and you may not be aware that seemingly harmless supplement can actually cause sometimes very grave medical consequences. One example is turmeric, a spice, which is a powerful antioxidant. It's touted as good for the brain, good for the body. But if you happen to be on a blood thinner, an anticoagulant, because maybe you have atrial fibrillation, you can actually now suffer a hemorrhagic stroke. You can suffer a very significant or even fatal bleed in your brain because the turmeric is an anticoagulant and your Plavix or your Xarelto or your Coumadin are anticoagulants.
Those are very technical terms, but they are often talked about with the doctor as well.
These drugs are commonly on television, so people are aware of them, but they don't know how that seemingly harmless supplement may impact their care when they're already taking those prescriptions.
And the other thing is that when you're actually going through the process of getting the diagnosis, if you're given a certain medication, it could actually kill you if it's not aligned with that diagnosis, like Lewy bodies disease.
With Lewy body, the example of very serious, and I'm glad you raised it, Lewy body disease, which will probably be a subject of a future program because it's a topic in and of itself. But if a person with Lewy body disease is given an antipsychotic medication like Seroquel or Risperdal, they have a much higher risk of actually a fatal event. than if it's given to someone with Alzheimer's. So if this is your loved one, you want to know which disease they most likely have. And again, we'll cover in the future, the early signs of Lewy body are significantly different than the early signs of Alzheimer's. So there is a way to parse it out and tell the difference.
And one of the biggest things that we're advocating too is to actually know what kind of disease and getting that thorough diagnosis. And I know we keep on hammering away at that, but there's a very legitimate reason. When I first started out in my career with Alzheimer's and community-based care, Alzheimer's was the umbrella. Well, a couple of years ago in the American Psychiatric Association, they came out with a different term, which I really feel fits. It's the real deal. It's the like Dick Robinson often says, it's the real deal, and just says, neurocognitive disorder. That's the umbrella, because we're beginning to notice and identify that there's this other types of disorders. Exactly. That are part of a real live disease process.
Exactly. Let me mention, talking again about this issue of medications is so critical. And why are we so strident about bringing all of your bottles to the physician? And by the way, this isn't just for that loved one that may be experiencing symptoms of dementia. This is for all of us. When we go for that annual physical, we cannot just assume that over-the-counter medications, supplements, vitamins, nutraceuticals that we have picked up over the counter are necessarily safe when we also take prescriptions.
And just as a sidebar with that, when you're a caregiver, you seem to forget about yourself.
That's right.
And you wonder why you're so tired. You wonder
That's
why
right.
you're so overwhelmed. And there's other types of medical conditions that could be going on with you as well.
Absolutely. And caregivers have to take care of themselves before they can hope to take care of someone else.
Absolutely.
So bring all the bottles. There is much more information on that bottle than there is on any list that you would have folded in your wallet. Generic names are very confusing. There are, according to the Institute for Safe Medication Practices, there are hundreds, I believe it's close to 900 look-alike, sound-alike medications.
And to understand the milligrams, 5 milligram with one kind of a medication and 5 milligrams for another kind of medication might be
a big difference.
A big difference.
And if you just have a list with the name of the drug, that is not telling the physician terribly much at all. People often ask me, why can't the pharmacist warn me when I pick up? And then I ask them, do you get everything at one pharmacy? And they say, well, no. There are things I get at CVS. There are things I get at Walmart. Well, there's no one that has that 360 view. And you may have multiple physicians. You may have a cardiologist prescribing certain things and your internal medicine physician prescribing other things, and they may not be fully aware.
And with some of your specialists, you may even be picking up from that specialist that medication as well.
That's right.
So now you've got thrown in the towel here.
No one really knows
that's
the whole
right,
picture.
And that's why it's so important, as you say, for that one physician to sort of analyze all those bottles and all those milligrams that are going into your body. I think you have something like saying, isn't there a saying that you have that for every type of medication you've got into your system, it affects you in so many different ways?
Well, it can. It absolutely can. And then when you layer on more prescriptions, you're just exponentially expanding those possibilities. And as we get older, our liver, our kidneys, not as efficient. They don't break down those medications as they may have done when we were 25 or 30. And so we can get a buildup of those byproducts of those drugs. Polypharmacy, and we will have a program on polypharmacy itself, 4 or more prescriptions. How many adults are on 4 or more?
Yeah.
Most of them.
CDC, it came out with the Center of Disease Controls, came out with the ages. Like if you're 65, you're on 5 or 6 medications. That's normal.
Conservatively.
As you go over to 75, that increases. And, so if, and there comes a point in time in your healthcare that medications become less and less effective.
Well,
especially if you've been
quality of life.
That's right. So that's where, if you have that physician that understands that, that's what's important.
Not only potentially less effective for what they were originally intended for, but potentially dangerous, ramping up your risk of falls, which can be devastating. Yes. 1 in 3 over 65, with or without a neurocognitive disorder, fall every year in this country. 20% of them will fracture or get a head injury, 20% of that population will actually pass away within a year. These are figures from the Centers for Disease Control, consistent year after year.
There's been a national campaign on falls, and I do think that type of advocacy has made a difference. I hear a lot, especially people over 80, I don't want to fall. I keep on hearing that, I don't want to fall. Well, there's other ways of being able to help prevent that.
That's right. And maybe they would live longer with those 9 prescriptions, but if they're high risk to fall and suffer a fall and never walk again, what happened to quality of life?
Yes.
So quality of life is an ethical principle as well, and how we want to live factors into our decision making and how we go about planning our own care, because we can have input into our own care.
And our next interviewer, the next guest that we're going to have on our program is going to be a lawyer and an elder law attorney, and that is going to be an important piece of the puzzle when it comes to preparing for quality of life.
Absolutely.
So, and we're going to be talking about other types of professionals, other people that are going to be guests of ours, and really going into shining a light on all these issues.
Please reach out to us, Alzheimer's Community Care, at 561-683-2700, or email us, info@alzcare.org. That's ALZCARE.org. You can also like us on Facebook.
You are absolutely right. Thank you, Karen. You're always such an inspiration, even for a lot of our listeners. And Alzheimer's Sunrise, on shining a light on our pathways for our caregivers and patients. And this is Legends 100.3 FM. And we'll
see you next week.
That's right. Early in the morning.
Thanks for listening to Alzheimer's Sunrise, lighting the way for patients and caregivers. To learn more about the help and hope available from Alzheimer's Community Care, call 561-683-2700 or visit alzcare.org. That's ALZcare.org. Tune in next Sunday at 6:30 for another edition of Alzheimer's Sunrise, lighting the way for patients and caregivers, right here on Legends 100.3.